Hello everyone, I'm Richard Conway from Dublin, Ireland, and I'm reporting for Room Now from ACR 2025 in Chicago. I want to talk to you today about abstract poster 1355 that was presented at Monday's poster session. And this was by Room Now's very own Janet Pope and colleagues. This was a study based in the CATCH early arthritis inception cohort in Canada. And it was asking the question of what happens depending on what route you might give patients with early arthritis glucocorticoids. And so this has been a topic of interest recently. When I first started out in rheumatology, which was, God, 20 years ago now, we used to do quite a lot of intramuscular glucocorticoids to treat patients for flare-ups and to treat patients who are newly presenting with arthritis. And then it kind of fell by the wayside a bit, and it just seemed easier to give oral steroid tapers. You just give a script and the patient goes off and takes it in their own time rather than going through the whole injection process. But the kind of debate and consideration of this was reignited by a study that Michelle Petrie did in SLE. And that showed that if you give the glucocorticoids intramuscularly compared to orally, that in SLE patients, they seem to be able to get off the steroids easier and have less side effects. And SLE has always been a particular difficulty with getting people off steroids, and how well that translates into our other conditions such as rheumatoid arthritis, it hasn't been entirely clear. And I think that this current study helps answer that question. So this was looking at an overall population of 2,222 patients with early rheumatoid. There were 421 of those who got oral steroids and 121 who got parenteral steroids. So this wasn't a kind of randomized trial or anything like that. This was just looking at what happened to these patients, what the clinicians were giving them. And then the parenteral group is slightly conceptually difficult in some ways. So this wasn't just intramuscular steroids. There was no intravenous steroids, but it was kind of a combined intramuscular and intra-articular steroid administration group. So combining those two groups together and comparing them to oral steroids. And what they found was that after a year of follow-up, there was no difference in the need for advanced therapies between these two groups. So it didn't matter whether you got oral or parenteral, but that there was significantly less persistent glucocorticoid use in those giving parenteral steroids compared to oral. And this was 26% versus 47%, so approximately half. So to me, that seems like a good idea. It seems these people are, in some sense, achieving better outcomes. Either they are doing better and not needing the steroids, or they're not becoming dependent on steroids like can sometimes happen probably because of the smoother kind of off of the parenteral steroid effect. So for me, this is kind of reinforcing a change I'd already started to make in my practice and shifting back towards more intramuscular and more intra-articular steroid administration and trying to minimize the oral steroids wherever possible. So I'm Richard Conway. Follow me on Twitter at RichardPI Conway and tune into Room Now for all the coverage from ACR 2025.